Hello again, everyone. Dr. Dan Bachman here, and it has been a long time since I've posted an update here about my situation. And there's a lot of things that have happened. So we're going to go over a lot of cool stuff that I can't wait to tell you guys. Some really big surprises in my lab work for the better. Also, tomorrow morning, 6 a.m., I'm having liver surgery. So they're going to take out about 15% of my liver. And that's supposed to be a 3 to 4 hour surgery. I'll be awake by about 2 p.m. our time here and seeing my family's in town, brother's in town, mom and dad. So have everybody taken care of me. I'm well taken care of. So I appreciate in advance all of your well wishes and your love and your prayers. So one of the cool things that's happened since last time. So let's do a little recap over the last almost a year since I was diagnosed. So I think I got diagnosed in maybe May or June of 2021. We are now February 6th of 2022. So I did 12 rounds of IV chemo, and where it actually runs in through my port. After that, I did 30 rounds of chemo radiation combo. So they irradiated me around my primary tumor and my abdomen. So they hit lymph nodes. Did 30 rounds of that every day, 5 days a week for whatever it was, 6 weeks, and taking oral chemo over that period too. Now, that ended, and since then I've been on a 2-week break. No treatment at all, and man, it's been nice because the pills, I mean, they make you feel kind of crappy. I mean, it's doable. I mean, I haven't missed any work. So, but it's nice to not have to, be icy cold after, like I was, because that's one of the symptoms. My feet are still numb. I got numbness in my fingertips, but I can drink things. I can swallow, and I'm not, I'm in zero pain. So sleeping fantastic. So, and in prep over this last 2 weeks on my break, I've been hitting exercise a lot harder. I've jumped up my diet quality even more. I always eat well, but I've been doing literally. Let's see, I do smoothies every day that have fresh beets and fresh kale, wild blueberries. There's something else I put in there. Kale, beets, blueberries, and apple, like some apple in there too. All of these things are known to be good for liver and digestion, and plus they're just kind of nutrient packed. They're all superfoods actually. So real nutrient dense. So trying to make sure my body has all the nutrients it needs to fight off cancer, to handle side effects, to handle surgery, and hopefully reduce, risk of complications, shorten my recovery time. That's my approach. I'm not following any plan. This is just me telling you, and I'm not advising any of you guys to do any of this stuff. This is just me telling you what I've done so far. And boy, does it seem like it has been helpful so far, knocking on some wood here. So I've mentioned in previous videos, there's a tumor marker that we test in blood work called CEA. I can't remember what the CEA stands for. Cancer, I don't know, antigen, or I don't know what it is. But basically normal amount of CEA for you guys who don't have cancer, normal is 0 to about 2.2 is normal amounts for everyone to have if you don't have cancer. My first one, the time I had that blood work done, back in June of last year, was 0 to 2.2. My first one was 168. So clearly out of range and really high. So the second one was, 29 or something. I'll see if I can put the document up on the screen so you guys can see this curve, as I have had 4 of them. Long story short, my current CEA that I had tested just last week, 1.6. 1.6. So I went from 168 all the way down to 1.6, which is actually normal. So remember, 0 to 2.2 is normal. I'm 1.6, so I'm kind of right in the sweet spot of normal. So, of course, I still have tumors, I'm sure, but the point is, they're not dumping their tumor stuff in my blood because the tumors are getting smaller and fewer in number, and maybe just less active. Maybe they're dying. I don't know what explains this, but I'm super stoked about that. My oncologist walked in with her mouth open. She's like, oh my gosh. So she said that pretty much never happens. She said commonly we'll get down to the 20s, For most people get in the 20s, but they don't go below that much. And my previous one, I think, was 9. So 168, 29, 16, 9, 1. So I'm pretty stoked about that. Met with my liver surgeon several times. Oh, originally I had 6 tumors in my liver when we first scanned. Bunch of scans since then, it went from 6 to 5 tumors. And my most recent scan, 3 tumors. So they're just disappearing. So originally, my liver surgeon said, we're gonna have to remove about half your liver. And again, the liver is about the size of a football. So cut half of that off, that comes out. But my most recent visit after I got my most recent MRI, it only showed 3. He said, we're only gonna need to remove 10 or 15% of your liver. So I'm stoked about that. I mean, I get to keep more of my original parts, which I'm cool with. And I'm assuming that the recovery is a little more straightforward, and there's just fewer opportunities for things to go wrong if you have most of your healthy organ there intact. So that's good. They're expecting that they're expecting me to need 3 to 5 days in the hospital for recovery. They're going to watch me. And I go into ICU right out of surgery, so they want to keep a close eye on me. There's risks for bleeds, other complications, so they're going to keep an eye on me in ICU first. They said, don't freak out when you wake up in ICU. It's just what we've been planning on from the beginning. It does not mean something went bad in surgery. So it's like, okay, that's good to know. So 3 to 5 days in the hospital. I am personally going to try to get out in 2 days. That's my personal goal. So whatever they tell me, I just figure that this data doesn't apply to me. So far, I've been right. So I've beaten numbers that even my oncologist didn't expect I would beat. So I'm just going to keep setting goals for myself. So I'm going to try to spend 2 days in the hospital. I mean, I can't imagine it would be less than that instead of 3 to 5. Before returning to work, they said 3 to 4 weeks. I'm going to try to come back in 2, but we'll see. I'm not going to force it if it looks like there's some risk to me or something. They said most of the risk is going to be pain at the incision site, or not risk, but the reason you can't come back to work sooner, because it hurts to cut through this muscle when that muscle's healing. They said inside the liver does great. I shouldn't have any liver pain, which is interesting. Also, I think I mentioned last time, they're going to take out a chunk of my liver. It's going to grow back in about 2 weeks. So I'll have a completely normal full-size liver in 2 weeks. That's how quickly a liver grows back, which is mind-blowing. I can't even conceive of something growing back that much mass in that short a time. But that's what he said. And he said we're going to use a robot to do the surgery. They're going to use ultrasound to guide the robot so it can go in there and snip and cut and so on. And they may, if they find some spots that are maybe too deep or hard to get to in the liver, they may stick a little filament in there that has a heating element on the end that cooks it. So they'll just guide the little filament to if there's some out of the way spots that need to be killed, and cook the tumor from the inside. But he says there may be 1, maybe 2 spots like that, but they're going to look while they're in there. Now he said we may need to make a hand-sized incision, so I can actually reach in there, he said, and turn your liver so that we can get to stuff on the back side of it. So I'll wake up and figure out which we needed. And who knows, it might be both. So the robot, I think, would be up high. I can't remember. Or so I may have an incision up high, or maybe one down low, kind of below belly button, I think, depending on what they see when they get in there and what they think they need to do. So that'll be a mystery, and that'll be solved when I wake up. What else? I've been sleeping great. Yeah, so basically my self-care regimen has been, I'm in bed 10 and a half hours a night. I sleep about 7.5 of that, 7 to 7.5, because I'm still getting up real frequently for bathroom trips. They're not painful, they're pretty short, but I still, my primary tumor is still there, and it's still limiting how much things can pass through. So it means frequent bathroom trips, and my urine flow is not great, but it's stable. And that's part of because the radiation inflames things in there in the course of killing cancer. So it's a little swollen, so there may be not room for urine to flow through there. So as the effects of the radiation fade away, I'm expecting to get better urine flow. Let's see, is there anything else? I'm sure I'll be forgetting. I went for a hike the other day. Maybe I'll put a little footage of that in here so you can see. Went for a great 2-hour hike, felt great. I'm in the gym. I'm exercising 4 days a week, maybe 5. When that's in the gym, I'm going to do squats, deadlifts, bench press, overhead press, curls, tricep press, seated cable rows, pull-ups. So that's most of my workout. And then getting outside, hiking, getting some sunshine, make sure my vitamin D is good. I'm supplementing with a few things. So I'm eating all the known cancer fighters, so all the cruciferous veggies, cauliflower, broccoli, Brussels sprouts. There's probably a couple others. And then and then beets, which are superfoods, kale, superfood. And then I also take turmeric and garlic, just for part of my food. I put the turmeric in my dressing that I spray over my veggies that I roast in the oven. Tastes amazing with a vinaigrette in there. And drinking at least a gallon of water a day. I think that's about it. So, and then once I have my liver surgery done, only maybe as soon as I've recovered, then we have my colon surgery, which is supposed to be the much smaller deal. So the colon, which seems like it'd be a big scary thing, taking out your entire rectum and then reattaching the end of the hose and have an ileostomy over here while that heals. And then once that heals and we can run food all the way through, we take the ostomy off and then this thing heals. And then my oncologist said that chemo is going to be a part of the future. We just don't know how big a part yet. So they're going to keep a real close eye on me, of course, in the beginning. Liver surgeon said the risks of this surgery, they're significant. So 80% of people who have my liver surgery, a liver resection, the cancer grows back, 80%. But remember, of those 80% of people, there's a bunch of, overweight or sedentary or people who have other illnesses on top of their cancer. Maybe they can't, who knows, maybe they're 90 years old, so they just have less ability to fight things off or handle a surgery. So 80% tumor grows back, but we'll be tracking that with scans periodically. He did say, my surgeon, he said, once you make it past about 3 years, or if you can get to 5 years out and the cancer hasn't grown back, that's the window that it usually grows back in. So therefore, my goal is to make it 5 years with no tumors going back. Then I can kind of back off. Maybe we just scan once a year or something like that instead of every 3 months. The other thing is that this surgery, liver surgery that I have tomorrow morning, 40% chance of serious complications, whether it's a bleed, or they said sometimes it kind of shocks, the surgery shocks your digestive system, and sometimes it doesn't start back up. So the main criteria they're looking at to release me after surgery is bowel sounds. Sounds that my gut is waking up. So he said, we want burps, farts, we want gurgling sounds. He said, you don't even have to have a bowel movement, but we want to hear signs that things are waking up in there. And when we see that, and you're stable and you're not in misery, then we'll release you. And he said, we're going to start off with just like Tylenol and stuff. Tylenol, maybe some ibuprofen, just kind of over-the-counter stuff to manage the pain. And I was really glad about that because I do not want to get on opioids if I don't have to. First of all, they constipate you, and constipation is one of my biggest issues already. So I don't want to add to that, and I certainly don't want to develop an addiction to opioids, which is a huge thing right now. I heard some stats on opioid deaths in the U.S. I mean, they're astronomical and highest they've been ever. So I don't want to go down that road. So so that's summary. Surgery tomorrow. I think I've kind of got you guys up to date. I think so. Again, so many thanks to all of you for being in my corner and commenting and just I can't explain how good it feels knowing I have you guys behind me and watching me. don't feel any obligation at all. But just knowing all of you are out there, people I have not met across the world, I love you all very much. And thank you for going through this adventure with me. It's good to have someone by your side. So thank you again. And I'll be shooting some little short updates as soon as I'm coherent, maybe from the hospital. We'll see. But stay tuned, and I will talk to you all soon. Bye-bye.